Welcome to the Health Channel, all health, all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios in Coral Gables. On today's show about the brain, we're talking about a seizure disorder that both children and adults suffer from, and it's called epilepsy. According to the National Institutes of Health, an estimated 150,000 people are diagnosed with this condition each year. This hour we'll be talking about what epilepsy is, how is it diagnosed, and the different ways it can be treated. And with me today to talk about this condition is Dr. Andrew Lerman, a neurologist from the Baptist Health Neuroscience Center. Welcome to the show.
Thank you for having me.
Thanks for being here. And I'm glad we're talking about this today because this is a condition that a lot of people sometimes really are not aware of, doctor, of the symptoms or what's going on. So first, let's talk about how often do you treat patients with epilepsy? I'm sure it's a lot.
Yes, I would account probably about 40 to 50% of my practice with epilepsy patients.
Wow.
While it's an uncommon disease, it does have significant impact on people's lives, and we do have a comprehensive approach to taking care of patients with epilepsy.
And that's good because there is an approach that gives people hope out there that they can live normal lives if they do suffer from this condition. Doctor, can we first talk, what is epilepsy? Define it for me.
Epilepsy is a neurologic disorder that actually consists of a predisposition to persistent epileptic seizures.
Okay.
And basically that means that a patient has an electrical predisposition to having seizures or clinical symptoms that are caused by aberrant electrical activity in the brain.
We have a 3D model that I'd like to share with our viewers that I believe shows the brain and a seizure occurring. So why don't you walk us through this and let us know what's going on?
So what's happening here, and while it's a basic model, there's an area of the brain that appears to have an increase in brain activity, and that quickly spreads to the rest of the brain, causing a seizure.
And that little, you see that little thing that's coming out in the center? I see all the blue around, but all of a sudden there's a little flash. What is that, doctor?
So that flash is the area or the focus that causes the seizure, and that's usually because of, again, some sort of electrical predisposition to firing, causing a synchronization of neuron firing within the brain, and thus what we see as a seizure.
And is this genetic, doctor? Is this just something that happens?
There are various causes for epilepsy. There are genetic causes as well as environmental or incurred causes such as trauma, strokes, neurodegenerative processes as well.
We have a graphic that I'd like to share with our viewers as well, the different types of seizures, some that you may experience or maybe someone that you know. Let's go through this, doctor, and excuse me. Focal onset, let's talk about that first.
So we do try to break our seizure types into two general categories. One would be a focal onset, so that means that the seizure originates in one part of the brain, and depending on which part of the brain that is, you will see a complex symptomatology or signs of that seizure. A complex focal seizure is a seizure that starts in a certain part of the brain and spreads locally and causes a dyscognitive state, so the patient becomes unaware. And the main difference between a simple focal seizure and a complex focal seizure is just that a simple partial seizure, usually you do not lose consciousness, you're certainly aware of your surroundings, and complex partial seizure usually causes some sort of dyscognitive or altered mental status state.
So one is obviously much more serious than the other, if you will.
One would have more impact than the other on day-to-day life, including, having to pay attention to certain tasks at work or in school or driving or so on and so forth.
Okay, so let's move on to generalized onset and then what's underneath. Define that for us,
So generalized onset seizures are seizures that occur not from one place, as we saw in that depiction earlier in that graphic. They're indicating a general predisposition or hyperexcitability of the entire brain all at one time. So they start in the whole brain. They cause different forms of seizures, including absence seizures, which are classic staring episodes that we're accustomed to seeing, and some of our family members or friends may have symptoms like that. Atonic seizures are basically when the body becomes limp and if people fall, they can incur certain traumas to the head, and that's a major repercussion from atonic seizures.
Of course.
Generalized tonic-clonic seizures are seizures that most people, when they think of seizures, and those of you listening at home, probably have witnessed one in your lifetime. They're very dramatic and very scary to observe. And these involve generalized tonic or ballistic limb movements, and you can't miss it, basically. A myoclonic seizure is a form of generalized seizure that causes basically myoclonus, which is a erratic generalized limb movement. Not quite as dramatic appearing as generalized seizures, however, very noticeable and very impactful on the patient's life.
Now, with all those that we just defined, and thank you for explaining each one so informational, is there one more common than the other, and can you have several of those at the same time? I don't know if that's a fair question.
Well, usually there are patients who can have different seizure types.
Okay.
Depends on the underlying cause of the seizures. There are generalized epilepsies that do have, as part of their syndrome, different seizure types. The most common, to your question, type of seizures are probably focal onset seizures. And why? Because they're caused by something many times. Many times they're not. But, you know, our patients who live with stroke, who've lived with head traumas, who've had surgeries, who have brain bleeds, so on and so forth, have a predisposition because of scarring of the brain, causing this electrical aberrancy and a predisposition to having abnormal brain activity.
All right. We have a list of the different signs, and you and I were talking about it before the show started, the signs and symptoms to look out for, which is so important because sometimes it's really important to get that help immediately when you see some of these signs. Let's walk through these, Doctor. I'll take the first one, periods of rapid eye blinking and staring. We've seen that. I've seen that sometimes in family members in my lifetime. Mm-hmm.
So I'm sure all of you listening at home can look at this list and start to think about people or family members that they've seen having symptoms like this. And not all these symptoms for sure indicate that someone has seizures. However, they could be signs and symptoms of seizure disorder. So periodic rapid eye blinking and staring is something that we do see with complex partial seizures or generalized seizure disorders. Jerking movements of the body, that's what we kind of talked about before with generalized tonic-clonic seizures and myoclonic seizures. Stiffening of the body, that's describing a generalized tonic-clonic seizure, where all the muscles and all the extensor muscles in the body all activate at the same time. Loss of consciousness. So there's various causes of loss of consciousness, seizure being one of them, and it's very important to take a detailed history and to understand what may have caused a loss of consciousness episode, possibly seizure, breathing problems, hyperventilating, and so on. Loss of bowel and bladder function. Very frequently we observe loss of urine or bowel control with a seizure, so it's part of our history and something we see commonly. So it's helpful in ascertaining whether this was a seizure or not. Falling suddenly, so we talked about atonic seizures and nodding of the head rhythmically. even could also represent seizures.
And some of these can be quite frightening if you witness it.
Absolutely.
A lot of family members will be staring and not knowing what to do, and we're going to talk about that in the next hour. But first, I want to actually turn our attention now to a video from Dr. Joseph Servin of the Mayo Clinic, who has some insight about the different ways epilepsy can develop. Let's take a look at this real quick.
Epilepsy can affect anyone at any age. That's the first thought you have to kind of remember. 1 out of every 26 Americans has a risk of developing epilepsy. Outside of that, there are some groups, especially young kids, that they may be born with it where they have a genetic reason for their seizures. However, the truth is seizures can occur from any other number of causes depending on how old you are and what's happening. So head trauma, certain infections, brain tumor, stroke, hemorrhages, even Alzheimer's disease. All of these things can potentially cause seizures and/or epilepsy. And there's a very strong stigma attached to the condition for wrong or right that's existed for so many years that it's only through talking about it, like interviews like this, that do you ever find a way to mitigate it and lessen its impact that way.
And creating awareness about it, which is what we need to do so people know what to do and how to live with this chronic condition.
Absolutely.
We have to take a quick break, doctor, but I want to ask you one quick question. Can you outgrow epilepsy?
Very rarely. There are forms of juvenile epilepsies that children can grow out of, but for the most part, people don't, and it's usually something that is very difficult to cure. However, with the right care, as we mentioned earlier, a comprehensive approach to care, including medication, support from family, support from the community, and medical personnel, patients can have good lives and lead limit-free lives. And that's our goal. And again, to his point, being here to talk about epilepsy and to kind of understand the stigma and also understand what goes into the epileptic's care will help us understand and help patients in the future.
That's right, and a lot is being done here at Baptist Hospital, which we're going to be talking about also in the next hour. A great support team as well. We have to take a quick break, but coming up next, we're going to talk more about epilepsy, including how is it diagnosed, how to live with this chronic condition, the help that's out there for you, and you're going to want to know because it's fantastic. You're watching the Health Channel, All Health All the Time on South Florida PBS, and remember to visit our website, allhealthallthetime.com, to submit questions for the experts or to find out more about the Health Channel right here on South Florida PBS. We'll be right back.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me is Dr. Andrew Lerman, a neurologist from the Baptist Health Neuroscience Center. We've been discussing epilepsy, including what it is and what causes it. Doctor, now let's go through the condition in terms of how is it diagnosed, when should you go see a doctor? Because there's a lot of people that may not know what's going on. We have a graphic that may help you understand when it is time to, get in the car and go see that doctor. Number one, a seizure. That makes it obvious. If you see a seizure, maybe it is time.
Yes, and again, what we learned in the first portion was that seizures can be anything from a generalized tonic-clonic seizure to abnormal behaviors, loss of consciousness, even head nodding. So if you witness any of these things in your family member and you think that this may be a seizure, it's very important to visit a doctor and seek out a diagnosis so that you can effectively be treated and as soon as possible. Unexplained loss of consciousness, if you or your family member experiences that, it's a very good idea to see a doctor and even a neurologist to do a full workup for both neurologic and cardiovascular causes. Unexplained shaking or rigidity indicating a seizure or a seizure-like episode should be evaluated. Unexplained memory loss or cognitive decline, something that we see in practice very often, and I get this question a lot, is staring episodes in the young. My son is in school and the teacher's saying, hey, he's staring off into space, and sometimes I can't get through to him for a few seconds. Abnormal sleep behavior, while that's very common symptom, it can also indicate certain types of seizures, particularly frontal lobe seizures. Waking up with evidence of unexplained blood on your pillow, unexplained muscle soreness, feeling very groggy for no reason whatsoever, and episodes of decreased responsiveness, which are recurrent and stereotypic, could also indicate seizures.
And we had 8 bullet points there. Do you wait for all of them or a couple of them, or if you see one of them?
I think that if you see one of them, it is a good time to intervene and be evaluated by a specialist who can evaluate for seizures and rule them out, or find that you may have seizures and help to guide you along the way.
And speaking of seeing an expert in diagnosing, there are different ways of diagnosing seizures. Let's show our viewers what those are, doctor. And you would do either a neurological exam, blood test, imaging test. Is that an EKG? No.
An electroencephalogram.
An electroencephalogram and spinal tap. So would you do all of those, doctor? Walk us through them, or is it just one or the others?
So each one has their value. Really, for the diagnosis of a seizure disorder, the definitive diagnosis lies in an electroencephalogram. Even with an electroencephalogram with video to capture an episode and to provide the patient and provide the medical practitioners involved with an electroclinical correlation that this is a behavior or a abnormal thing that we observed, and this is the aberrant electrical activity in the brain, and there lies the definitive diagnosis. The other tests mentioned, the neurological exam, the blood test, the imaging test, and the spinal tap, these are adjunctive tests to support your diagnosis, and in many cases a neurological exam could indicate cognitive impairment, poor attention. Even after you've had a seizure, you can have residual weakness in the arm affected, which is called Todd's paralysis, sometimes looking like a stroke. Blood tests in the acute setting You can have an acidosis or a prolactin elevation or certain types of blood tests that help us along the way.
What's a prolactin elevation? I'm sorry?
Is a certain hormone that our brain produces that can sometimes be elevated after a seizure. Not again, just an adjunctive kind of test. Imaging tests, we have MRI, which could indicate a lesion in the brain, a tumor, a stroke that could be causing the seizure. There's also more sophisticated imaging tests in that we measure the activity in the brain, in certain parts of the brain, using SPECT analysis, where we can look at the metabolism within certain parts of the brain and extrapolate and say, oh, well, that part of the brain is not metabolizing well and may have a seizure focus there. So spinal tap was mentioned. It is a good idea to perform a spinal tap in a new onset seizure that comes out of nowhere. We don't know what caused it. We want to rule out an infection because that is a treatable cause of epilepsy.
So obviously a lot of tests that will give you an accurate diagnosis, which I can only assume is extremely important to get.
Absolutely. All of these tests are equally important. Again, the video EEG is a super important part of the workup, and a very good clinical history to put everything together and help provide an accurate diagnosis.
So doctor, let's talk about when you receive that diagnosis. Now you're telling, a mom, a father, a grandparent, an adult, okay, you are suffering from epilepsy attacks, we need to take care of this. There's a lot of stigmas when that happens and living with it. How do you then talk to the patient? Because at that moment, you mentioned to me in the break, they don't want to leave the house, they don't want to go to school, they don't want to go to work. It's awful.
Absolutely. So that's why we're here again to discuss things like this. And this is a medical condition. It is very difficult in some cases to control, and again carries a lot of stigma. Patients are embarrassed about having to take medications frequently, or losing consciousness, or having, in some cases, seizures are quite drastic and require a lot of attention, or incite a lot of attention around them. So you're in the community, you're in the grocery store, you're afraid of having one of these episodes so that people know what this is.
And even driving, I think at that point, you may not be able to.
Right.
And that's, again, another limitation.
Absolutely. And, a lot of my patients mention, and I'm sure anyone listening, mention dependency on family members as being a very difficult stigma, and that they feel that they're a burden to their family and friends, that they're constantly having to be driven places and so forth. So we try to treat the disorder, minimize the symptoms in order to minimize the stigma around it, but also awareness, and also building a support system within our society is a very important process, and we must not lose sight of that. Things like transportation services for our patients. As the medical community changes, teleneurology or tele-epilepsy is very important for patients who can't leave the home very often. So we're thinking about things, and as we technologically advance, hopefully our patients will experience less stigma and live better, happier, and better quality lives.
And when a patient comes in with obviously an epilepsy diagnosis, do you bring in the family, and do you educate the family as well? Because like you said, the support system is important. Baptist has a support system that we're going to be talking about in the next commercial, after the next commercial in our next segment. But do you come and talk to the family to help educate them? Because it becomes really a huge support system.
Absolutely. Family is a very important part of any medical condition's care. In the neurological realm, absolutely. In epilepsy, it's crucial. And family members not only need to understand what the condition is and what are some of the neurological repercussions, which could be behavioral. Patients who have epilepsy, and maybe some of you listening would relate to this, have a much higher predisposition to having mood disorders, such as depression, bipolar disorder, anxiety disorders, and people with mood disorders also have a higher predisposition to epilepsy. So understanding the cognitive potential, problems with sleep, sleep-wake reversal, and so on, is very important for the family to understand and help to support the patient moving forward.
And we have a video from the Centers of Disease Control and Prevention explaining why self-management programs can help people with chronic conditions. Let's take a look at this real quick.
People should enroll in these self-management education programs because you will learn how to help yourself to improve your condition, because you need to have control of the things that you can do for yourself. When you achieve something that you set out to do, it gives you a level of self-confidence. And in health, there's a lot of hurdles to step over, new things to have to try or do or participate in, or medications to take. And you need to have self-control, you need to have confidence. And I'm sure that as those people who have practiced it, used it in other areas of their life, and a lot of people in the Living Well with Chronic Conditions program, they'll talk about eliminating eating habits or trying to develop an exercise program. And when they come back and they say that, well, I did that. I walked 2 blocks and I haven't done that in a number of years, they felt extremely pleased with themselves and they found out that they could do it. You are able to make those changes that might be beneficial to you, such as developing a better nutritional choices, exercise, reduce the amount of pain. It will help you to work better and communicate better with your healthcare providers and also your family. I would recommend self-management education programs because we're not alone. Others have health issues, and together as we learn about how to be a better manager for ourselves, we will have a better future.
A better future, and that's what we want. You wanted to add something about family.
Yes. While I said it's very important for them to be involved, it's very important for the physician to involve family in the discussion about treatment, about how to approach this, about support services at home. So I always encourage in my practice family to bring brothers, sisters, mothers, not just your mother, your primary caretaker, but the caretakers need support as well. So very important point. In the epileptic's care.
Right, because if they're educated, then they can understand what's happening as well.
Absolutely.
Fantastic. All right, thank you right there. Stay right there, doctor. We have to take another break, but coming up, we're going to be discussing different treatment options for epilepsy, including medications, surgery, and other alternative therapies, because there are things out there for you. So stay tuned for that. You're watching the Health Channel, All Health All the Time on South Florida PBS. And remember to visit our website, allhealthallthetime.com, to submit questions for the experts or to find out more about the Health Channel. And we'll be right back. Stay tuned.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for CURE, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Worried about keeping your brain sharp as you age? Studies show that these 4 steps may help. Stay physically active. Strive for 2.5 hours of moderate exercise weekly. Reduce vascular risk factors like high blood pressure and cholesterol with good diet, adequate sleep, and medication when necessary. Talk to your doctor about diseases and drugs that may impair brain function, and keep your brain lively with social and intellectual pursuits. For more information, visit dana.org.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me today is Dr. Andrew Lerman, a neurologist from the Baptist Health Neuroscience Center. All right, doctor, now I want to talk about treatment. First of all, how important is it to treat epilepsy? Because you just can't let it be.
Exactly. Yes, if somebody has a seizure disorder, it needs to be treated. There are various treatment options. I mean, the conventional medication is usually where we begin. In some cases, people are refractory to conventional treatments and may require a further, more invasive management.
And if left untreated, which obviously we're not going to do, but if, God forbid, someone doesn't want to treat it, can there be damage to the brain? A lot of parents are sometimes fearful of that.
Yes, if we do not treat the seizures, they can, one, cause significant disability for the patient, incur more trauma to the brain, more injuries to the body. You can, unfortunately die from seizures. While it's very rare, it's certainly a concern for those treating. Because
they can get worse if left untreated, if I may ask?
So if left untreated, the more seizures that you do have, you can produce more areas of the brain potentially that can cause seizures or serve as focus for new seizures. So yes, there's a kind of what we call kindling effect. But our biggest concern about people being untreated with seizures is really the risk for disability and injury to themselves related to the seizure itself.
You mentioned a word a few seconds ago. I wrote it down, refractory. What is that?
Refractory means that despite medicine, despite being treated with 1 or 2 medications, your seizures are still ongoing and not controlled effectively.
All right, but let's talk about getting it controlled. What medications are, I guess, your go-to first line?
Well, we live in very interesting times, and it's a very exciting time to be an epileptologist right now because we have new drugs coming to the market all the time. We have newer medications that are based off of older medications that kind of minimize side effect profiles, minimize drug-drug interactions, and still have high efficacy. There's maybe 15, 20 years ago, 5 or 6 medications available to our patients, and now we have 20, 25 medications available. We have surgical options. We even have alternative treatments that we'll get into later.
We're going to touch upon those surgical options. The medications, is it like a trial and error, if you will, that you maybe not responding to one and may need another one, and that's okay?
Yes, it is trial and error. To some degree, there are medications that are better for generalized epilepsies, and there are medications that are indicated and better for partial onset seizure disorders. However, once you've had a diagnosis, picking the right medication is really a complex psychosocial issue in terms of optimizing compliance with the medication, minimizing side effects. You know, in the young or the old, we don't want to cause any cognitive side effects. We have to go to school, plus you may not have a good cognitive reserve. Certain types of medications for other conditions, like people with liver disease or renal disease, can't receive certain medications. So you optimize and choose your medications based on people's comorbidities, what we need to focus on. So I treat a lot of college kids, and we don't want to cause any type of cognitive or behavioral issues in a college kid, because they have the world in their hands, they have a lot to do, they're doing sports, they're doing school, they may be sleep deprived, they may forget their medication. So it's really about picking the right medication for the right population of patients.
Can medication sometimes be enough, or do you sometimes then have to incorporate a surgery, or do they go hand in hand?
Most of the time, and most patients are controlled with medications. There's a small proportion of patients who are considered intractable or medically refractory, and they require 2 to 3 more medications, to 3 medications at once. While saying that, as we know from data, as we add more and more medication, the chances of getting seizures under control in that population goes down considerably. So then we need to think about other options, and surgical options are certainly considered in certain patients who have what we feel is one area of the brain focus that causes the seizures that could serve as a surgical target.
And let's look at these options requiring surgery. There are 4 of them. Just walk us through as quickly, doctor.
So types of surgery for epilepsy include lobectomies, so a lot of temporal lobe, that's really speaking to temporal lobe epilepsy, hemispherectomies in very severe cases of epilepsy. They will take out a whole part of the brain, a whole half of the brain, excuse me. Corpus callosotomies are basically surgical procedures that disconnect the right and the left part of the brain and allow and prevent propagation of seizures from one side to the other, thus diminishing the severity and the frequency of the seizures. And then we have laser thermal ablation treatments, which are relatively new, which are very exciting, which are minimally invasive, that basically surgeons can go in through one small hole in the brain, find the seizure focus, and ablate it, and then get out. Patient can go home almost the next day. So it's a very exciting type of option.
And that helps prevent them from happening?
Yes, in the future, and it can even be in many cases, and that's the goal of surgery, is a curative approach.
That is fascinating. There's also, by the way, a brain implant that can help treat seizures. It's referred to as a responsive neurostimulation device, and we have a video that tells the story of a patient who has tried it out. Let's take a look.
What brought me here were seizures. Basically, I had a brain tumor, like, since I was born. They took it out in Colombia. After that, I had a lot of seizures.
Today we're doing the first case of the NeuroPace device implantation in a patient with brain epilepsy. This is a young gentleman with persistent seizure activity, and we know that the seizures originate on both sides of the brain, and the seizure activity has been resistant to anti-seizure medications.
We're going to do an implantation of the RNS device. It's a responsive neurostimulator produced by the NeuroPace. You put this in the skull, and it's implanted at secure with titanium screws. And from this area, we're going to put 2 electrodes that go to areas in the brain that are producing the seizures. Once that we start capturing seizures, then the device is going to start sending stimulus back to try to stop the seizures.
The expectations we have as a whole family with this procedure is reducing dramatically, or as possible, seizures that Fernando is having. And we'll hope that after this procedure, he will improve a lot.
It makes me feel great that we could help this young gentleman because he looks like he's very functional, even though he is affected by the seizure disorder. I hope that we will be able to bring him back to as much of a normal life as possible, get back to his normal activities.
Today, they're gonna activate the NeuroPace with the information that they've gotten for these 14 days.
I wouldn't be surprised if from the beginning there's some improvement, but it takes time.
I don't feel any pain, and 70% of the seizures are gonna be stopped.
That just right here, that just hits me right here. You have patients who have done that procedure. It's a game changer.
It is a game changer. It's very exciting for the epilepsy world and for our patients. I've had many patients treated with RNS, we call it. Not only is it an amazing potential for therapeutic benefit for patients, but diagnostic benefit. So by having the electrode in the right place, you can monitor how many seizures patients are actually having. The device responds to those seizures and blocks them from propagating and blocks you from having such frequent events. It's minimally invasive, so as this young gentleman was saying, his life really, before and after the operation, really didn't change very much. When we're exposing our patients to lobectomies and corpus callosotomies and hemispherectomies,
that sounded a bit more serious to me.
There's serious potential repercussions, and for us, it's a balance between causing harm and helping with seizure control. So RNS has really provided us in this realm with a great tool for both diagnosis and for therapy and potentially for curative approach, again, in a minimally invasive way. So we're very excited about it. A lot of my patients who have gone through the operation are living very good quality lives now, almost seizure-free, many of them. And that's really our goal, is to let our patients live the best quality lives that they possibly can with minimizing the amount of seizures that they have, hopefully minimizing the side effects that they experience from medications, and allowing them to live and prosper, and it also affects their families and friends and community that we live in here in South Florida.
Ah, fantastic stuff. Amen. Amen. That was fantastic. Great. I love that video. All right, so we're going to take a quick break, but don't go away because we're going to be talking more about treating epilepsy, including some different diet and lifestyle suggestions and what Baptist is doing to make a difference. You're watching the Health Channel, All Health All the Time on South Florida PBS. Please visit our website, allhealthallthetime.com, to submit questions for the experts or to find out more about the Health Channel. Stay tuned.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty, and if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me today is Dr. Andrew Lerman, a neurologist from the Baptist Health Neuroscience Center. Now, before the break, we were talking about treatments. Doctor, now I want to talk about something that we're hearing a lot about, and I know it's called medical cannabis. Very popular, being used to treat epilepsy. What is that?
Yes. As many of us have heard in the news, and it's become a very hot topic lately, CBD, particularly cannabidiol, has made its way into the medical community for treatment of epilepsy. And I had the fortune of being involved in some of the early studies, the Epidiolex studies, which are actually, as most of us in the community have just heard, that the FDA has approved Epidiolex, which is the first cannabis or a CBD medication to be approved for epilepsy, and this is for intractable epilepsy. But we do use cannabis to treat very intractable seizure disorders. It's only used as an adjunctive treatment, so that's in patients who are already on medications. Their seizures are continuing. They may not be good surgical candidates. So it's an added alternative treatment that could potentially help a lot. There are certain epileptic syndromes that I've seen some very good results with, others less, but we're still figuring out dosing. We're still figuring out all the potential interactions. But we are very excited about this as a potential treatment. And again, our goal every day, going to work and going home, is knowing that our patients are receiving any potential benefit or any potential treatment that they can. And we are seeing some really great things and good effects on people's lives. Anxiety, seizure control, sleep quality.
How does it control it in layman terms, if you could tell us?
Well, it acts through its own receptor system. Our brains do have an endocannabinoid system that already produces these similar chemicals. So by kind of honing in on that, patients and other doctors have really been able to see a great effect on seizure control, amongst other treatment for other neurological diseases. So in some of my patients, I have one young child who we saw the other day in the office and was having about 20 drop attacks per day when he first started on the cannabis trial, and now he's having about 1 to 2 per week.
Oh, that's
so
fantastic.
I mean, very drastic changes. That's not the case in every patient, but there's a potential for that. So it's something that we need to pay attention to.
Fantastic to hear that about that child. Now, another popular therapy for epilepsy is the ketogenic diet. So we have a video to show you, and we'll talk about it with the doctor right after. Take a look. Okay, so from what I got from that video is high fat, low carb. Why is it working?
Well, high fat, low carbohydrate diet.
I mean, it's great for everyone.
Is a good approximation of the ketogenic diet. It's a little bit more rigorous than that. However, the idea is that you create a state of ketosis within the body. We believe that, as in other medical conditions, metabolism and brain metabolism has a big role in seizure potential. So the ketogenic diet and the state of ketosis changes our metabolism within the brain, and we've seen a great effect in terms of seizure control when patients are compliant with this diet, as well as cognition. And we're also seeing it in the Alzheimer's realm, but in the seizure realm, when you are compliant with this type of diet, and it's a good adjunctive therapy because it's a different mechanism of action, not just medication, not just surgery, not just something you take, but a lifestyle change. And it's shown to be very effective, and we have a lot of patients who comply with it and do very well.
We are nearing the end of the show. We have a few minutes, and I do want to recap what I feel is really important, which are the signs and symptoms of seizures. A lot of people get very frightened when they see this, but it's important to note that when you see periods of rapid eye blinking and staring, jerking movements, stiffening of the body, which we talked about, doctor, earlier, loss of consciousness, breathing problems, loss of bowel or bladder control, a falling suddenly, a nodding head rhythmically. These are the symptoms, signs of a seizure. Doctor, if one were to see a family member, a friend, a loved one going through any of these, it doesn't have to be all of them like you had stated earlier, what do we do? What do we act?
Well, if you do witness a generalized tonic-clonic seizure or any type of seizure, the idea is to get your family member into a safe position or safe situation. So if a patient falls to the ground, or you see a family member fall to the ground and is appearing to have convulsions, you may want to lay them on their side. Do not stick your hands near their mouth or in their mouth, because there's potential for uncontrolled biting and so on. You really just want to protect the airway. Think about preventing the patient from injuring themselves on a nearby object, on the stove, and so forth and so on. And do not hold the patient down very hard, because that could also potentially lead to injury.
I know you're very passionate about this, and it's very near and dear to your heart. So is the Level 4 Epilepsy Center here at Baptist Hospital. It's amazing what they're doing there. Can you share that with us?
Absolutely. So this has been a work in progress, and really we've come a very long way here at Baptist. With the support of Baptist Health, we've been able to build an Epilepsy Level 4 center where we can do surgeries. We really don't have any limitation. We do pre-surgical evaluations in our epilepsy monitoring unit, where patients come in. We evaluate where the seizures could potentially be coming from, the types of seizures, the frequency of seizures. We optimize medication regimens. We also evaluate patients off of medication to see where seizure focus could be coming from and whether they could be a good surgical candidate. We work hand in hand with a group of neuropsychologists, Baptist a neurosurgical team, all to provide a comprehensive approach, also with a support staff, social work, nursing, and so on, and coordinators to provide a comprehensive approach to seizure care. And we're very proud of what we built here, and we continue to grow every day.
Great stuff. And we only have a few seconds, but I think I want to end our show with the fact that there is hope, and you can live a very normal life even though you are suffering from epilepsy or having seizures.
Absolutely.
A few seconds to say that to our viewers.
Absolutely. And we, again, live in a very exciting time with newer medications, with minimal side effects, with surgical approaches that can potentially have significant impact on our patients' lives. And we're very excited to live in these times and provide good care for our patients.
Fantastic stuff that you're doing. Thank you,
Thank
Doctor.
you.
Please join us again.
Thank you.
Appreciate your time.
Thanks
And that's
for
all the
having me.
time we have on the Health Channel. Remember the Health Channel, all health, all the time. We'll see you next time. I'm Olga Villaverde. Have a great day.